Good morning, ladies and gentlemen. I'm Kuo C1 from Cardinal Tien Hospital, Taipei, Taiwan. Today, I'm speaking of our latest research on bladder installation of Encapsulated-botulinum Toxin A Mucoadhesive Nanoparticles for hydrochloride-induced hyperactive bladder in rats model. Interstitial cystitis, also called Bladder Pain Syndrome, is defined as a persistent or recurrent pelvic pain, pressure, or discomfort related to the urinary bladder. It also requires at least one associated lower urinary tract symptoms and exclude infection or other identifiable causes. Current AUA guidelines for interstitial cystitis put cystoscopy and hydrodistension as third-line treatment, and put intradetrusor injection of Botox as fourth-line treatment. EAU guidelines also suggested intradetrusor injection of Botox if other treatment failed. Botox is a neurotoxin protein acting on neuromuscular junction. It cleaves the snare complex formed as SNAP25, syntax, and synaptobrevin. By cleaving snare, it inhibits the binding of synaptic vesicle and inhibits releasing of neurotransmitter acetylcholine, and further dampening smooth muscle contractions. Intradetrusor injection of Botox requires cystoscopic assist under general anesthesia. It is more invasive compared to intravesical instillation, which could be performed at OPD settings. So if intravesical instillation could achieve similar outcomes, it is much more promising. Botox is a hydrophobic protein, so encapsulation is needed for Botox to bind to bladder mucosa for further action. In our study, we invented a new Botox complex called EBMN using hyaluronic acid as binding agent, alginate and gelatin as nanocarriers to facilitate the Botox transfer. We used rat model to mimic cystitis and to evaluate the efficacy of EBMN. Female rats were introduced with intravesical hydrochloride to induce a hypersensitivity status mimicking cystitis. Rats were divided into 4 groups of installation protocols, introducing different agents at day 0 and day 1, as demonstrated at the top right corner. The saline group using only normal saline at day 0 serves as the control group. The hydrochloride group using hydrochloride at day 0. The saline plus Botox group using normal saline, followed by EBMN. The final hydrochloride plus Botox group using hydrochloride followed by EBMN. All rats received cystometrogram at day 7, measuring bladder voiding contraction amplitude, duration, and intercontractional interval. The rats were then sacrificed and the whole bladder was sent for Western blotting to measure the level of SNAP25. Here are the results. First, on cystometrogram, we could see the pattern of higher voiding amplitude and shorter intercontraction intervals in the hydrochloride group. In the treatment group, the hydrochloride plus Botox group, we noticed treatment results with a pattern of shorter duration and longer intercontraction intervals. Let's take further detailed look. Here shows the bar chart of bladder pressure and contraction amplitudes. We noticed a higher baseline intravesical pressure of the hydrochloride group, also showing higher contraction amplitude and maximum amplitude. The treatment group showed a return to baseline on all 3 parameters. Here on the left side shows the duration of voiding contraction, which no significant difference noted between all groups. On the right side shows intercontraction intervals, which we noticed a much shorter interval in hydrochloride group, representing urinary frequency in cystitis rats. Then we noticed return to baseline interval of treatment group, representing the treatment effect of Botox. Here shows the histological staining of urinary bladder. We noticed marked increase of neutrophil on hydrochloride group, representing an increased inflammatory state in the cystitis rats. Second, we noticed that in the hydrochloride plus Botox group, the neutrophil level returned to baseline level, representing resolution of inflammatory state in the treatment group. Finally, we did Western blot to evaluate SNAP25 of the snare complex. We noticed decreased level of SNAP25 in the hydrochloride plus Botox group, representing Botox cleaving SNAP25 at the neuromuscular junction. In conclusion, our rat model successfully induced a hypersensitivity status by hydrochloride, representing cystitis model, and the use of encapsulated Botox, EBMN, successfully ameliorates the hyperactivity status. The result in our study suggested that other urothelial injured disease might also be beneficial from Botox instillation using our newly invented EBMN complex. That's all of my presentation. Thank you for your attention.